Mr. President, I am a pediatrician in New York City. I am constantly confounded by the complexity of our current patchwork and Band-Aid covered healthcare system. In addition to employer-sponsored health plans, we have Medicaid for poor adults and children, Child Health Plus for working poor children, a vaccine program for children whose insurance doesn't cover vaccines, workers' compensation program to provide coverage if you're injured on the job, special programs to cover the medical care expenses of people who have no insurance, insurance to cover the injuries sustained in a car accident. We have Medicare, Medigap, and we even have tax-exempt MedSpend accounts to cover the cost of care that isn't covered by insurance. My patient's choice of physician is often very limited by the specific insurance plan that covers them, often excluding some of the best providers. As a provider, I take 15 different insurance plans, which each have a minimum of 5 different subplans, many of which reimburse me at different rates, which they will not divulge to me without a major struggle. My records are electronic and have been for 7 years. Even so, it costs me 2% of my budget to submit claims electronically because I must get 54 items of information absolutely correct, or the form will be rejected. That information is in addition to the information regarding what I did at the visit, the diagnosis and the procedures. After I submit the information electronically, and it is processed electronically, I wait 1 to 2 months for the check. I spend 7.5% of my budget collecting the money from an insurance company which spends 20 to 25% of the covered person's premium trying not to pay the covered person's expenses. What can you do to simplify this process? I'm getting to the point where I will cease being a provider, and in a few years, I'll become the consumer. I need help, both as a provider and as a consumer. Thank you.